So today we'll talk about other vitamins, mostly water soluble vitamin. First is vitamin C. The other name of vitamin C is ascorbic acid. What is the another name? Ascorbic acid. It is very important and versatile vitamin. Okay, it will play a very important role in human health and disease. Okay, vitamin C has the most controversial vitamin in recent years. This is because of the claims and counter claims on the use of vitamin C in mega dose to cure everything from common cold to cancer. So vitamin C is the ability to cure from cold to cancer. So very important. Scurvy has been known to man for centuries. It was the first disease found to be associated with diet. In 16th century, about 10,000 mariners died of miraculous disease, scurvy, due to lack of fresh vegetables in their diet. A surgeon of uh, English Navy in 1753 published, based on uh, this used to supply lime or lemon juice to all the crews. The English Navy used to carry crates of lemons, hence they were properly known as limeys. Okay, so you listened about those things. So thousands of people were died due to the lack of vitamin C in the diet. Okay, so after that, in 1795, they are supplying lemon juice for the persons who will travel in the navy or marine, etc. Okay, so this is the importance of vitamin C. The vitamin C is also known as ascorbic acid. Already I told that. So metabolism. Many animals can synthesize ascorbic acid from glucose. How man, other primates, and cannot synthesize it. Okay, rapidly absorb from intestine. So who absorb vitamin C? Like vitamin D, also vitamin E, A, all are absorbed in the fat, but vitamin C absorbed in the intestine and not stored. Okay, it is utilized, and if excess amount, it is excreted from the urine. Okay, what are the function? Most of the vitamin C functions are oxidization. Okay, first is collagen formation. So if you want to uh your facial glow, your skin want to glow, your hairs are smooth. So what we need? We need vitamin C because they have coenzyme hydrolyzation, proline, lysine, very important thing. Okay, so whatever collagen, if you want to give the collagen shininess, you want to give collagen hardness, skin, or any part of the body, so you need to take vitamin C because it will do uh, oxidation, bone formation. Okay, in the bone tissue, uh, collagen and the inorganic calcium, phosphate, etc., is required for vitamin C in the bone. Calcium is there, phosphate is there, collagen is there. So if you want to more strong bone formation, we need vitamin C. And iron and hemoglobin metabolism also need vitamin C to enhance the absorption. Okay, it helps in the formation of ferritin. So whoever have HB deficiency, or whoever have blood deficiency, iron deficiency, anemia, they need to take vitamin C. Okay, very important. Hmm. Tryptophan metabolism. So it is important in for synthesis of serotonin. Okay, and other functions also there: tyrosine metabolism, polyacid metabolism, peptide hormone synthesis. Okay, all the immunological functions. What it will do, it will synthesize the immunoglobulins, antibodies. If you large amounts of bacteria is coming, if you're taking vitamin C, your antibodies production is very strong. Okay, and the risk reduce the risk of cataract formation. So vitamin C is important for cataract formation. Okay, because of oxidization and reduce the heart risk, cancer risk, coronary heart disease. Very, very important. So you need 60 to 70 milligram vitamin C per day. If the man is pregnant, we need 20 to 40% extra. So what are the dietary foods? Citrus fruit, amla, guava, green vegetables, cabbage, spinach, tomatoes, potatoes are rich in ascorbic acid. High content of vitamin C is found in adrenal gland and gonads. Milk is poor source of ascorbic acid. So milk doesn't have vitamin C. Okay. So adrenal gland gonads having the rich amount of vitamin C. Okay. Even animals. So who are vegetarian, you can follow the citrus foods like lime, amla, guava, green vegetables, tomatoes, potatoes, etc. And if you want more high content, if you're non-veg, you can go through adrenal gland and gonads. What are the symptoms of vitamin D deficiency? What will happen? They have loose teeth, sore gums, anemia, swollen joints, fragile body vessels. Okay, delayed wound healing, sluggish hormonal function. Most of this is related to the impairment in synthesis of collagen. Okay, so collagen, if you want to go, if you want to strong your collagen, you need to take vitamin C. Okay, so vitamin C is very, very important for our body, for everything. It will cure from cold to cancer. Okay, with the help of immunity. What we if you take large amount of vitamin C. Okay, if you want to cure common cold, what will happen? You will increase the take of ascorbic acid, means 80 grams per day, 300 times the daily requirement. Megadose still contain common cold, wound healing, trauma, etc. So in the during disease, you can take more than normal dose. Like we have 40 to 60 to 70 milligrams is there, but here taking grams, you take more than that. So uh, what will happen? If you are diseased, then it will okay, no issues. Hmm? Sometimes it will, if more than that, uh, you have formation of major metabolite of vitamin C, oxalate type of kidney stones. But in the more megadose, not in normally, more megadose can have the mm, formation of oxalate stone in the kidney. Okay, so this is about vitamin C. Now we'll talk about vitamin B1. B1 is known as thiamine, anti-beriberi. Okay, functions they have to maintain the enzyme. Okay, and enzyme already told. Enzyme for enzymatic purpose you need vitamin B1. Very important. So for nerve transmission, if there is nerve, you need to transfer the impulses. So you need vitamin B1. Okay. So vitamin B is very, very essential for the transmission of impulses. How much amount you required? 1 to 1.5 milligram per day. 1 to 1.5 milligram per day. Okay. Dietary source cereals, pulse, oil seeds, and in the pregnancy, more than that 2.5 grams like that. Yeast and good source. Thiamine is mostly concentrated in the outer layer. Means the whatever seed is there, outer layer having vitamin B1. But what will happen nowadays? Everything is uh like rice is the outer covering. We are taking with that, and polishing is done. Okay, we are not utilizing. Okay, without polish, we are not using the food. That is the most dangerous thing because every vitamin is covered on that covering. So B1 is having 80 or 80% on the covering. So what will also present in animal food also like liver, heart, kidney, milk, etc. And mild rice, thiamine not lost in polishing since thiamine is a water soluble vitamin. Okay, because it is present in that rice. So if you dissolve in the water also, it will present. Okay. Yeah, so it is extracted into the water during cooking process also. Such water should not be discarded. So in olden days, what will happen? Whatever boiling food is there, we cannot like rice. Nowadays, we are boiling the rice and we are wasting that rice water. So in olden, what will happen? They will along with that rice, they drink that water also. Okay. So vitamin B1 is present, the covering of the seeds and cereals. Deficiency, what will happen? The impulses will weak. The patient have nerve pain, peripheral neuropathy, numbness in the leg, pins and needle sensation. So that's the reason doctor will give a B complex remedies. Okay. There's other things you have to remember. Next is vitamin B2. So what are the vitamins we studied? We have to remember that water's fat soluble vitamin A, D, E, K, and we have vitamin. Now we studied C, B1, and now B2. Okay, C, B, B1, B2. This is water soluble and fat soluble. Okay, water soluble, fat soluble. Vitamin B2. It is also for coenzyme oxidization. Okay, this is the important thing we have to remember. And other than that, what are the function? Mm, energy production. For energy production, we need vitamin B2. Okay, we need 1.2 to 1.7 gram. Again, if it is pregnant, a lactic woman, we need more dietary source of milk, milk products, meat, eggs, liver, kidney are the rich source, and as well as cereals, fruits, vegetables, and fish are moderate source. Even rich source, you have to go non-veg, and mild source in the vegetables. Deficiency, a patient have riboflavin. Vitamin B2 is riboflavin. Okay. Oh yeah. This vitamin in the recent time, whatever whoever has mouth sores, they will go to the medical hall and they will buy riboflavin medicine, riboflavin and multivitamin. They have tongue smooth, purplish deficiency. Such is uncommon. Okay, but sometimes a deficiency will happen. Next is niacin. Niacin is a another multivitamin belongs to vitamin B12. What is its function? Mm. Then again, oxidization. So all these are oxidization to protect our body, to enhance the immunity. These are the main functions of vitamin. Okay, B niacin. So we need 15 to 20 grams. In the pregnant woman, 60 grams. It will increase. Dietary source are liver, yeast, whole grains, cereals, pulses, beans, peanuts, milk, fish, egg, vegetables. Okay, all this have those things. Okay, and diet. If you doesn't take, what will happen? Rough skin. One disease will occur. That is called pellagra. More. Okay, okay, that will happen. It not only involve the skin, the internal uh, covering of gastrointestinal tract, central nervous system will also affect. Dermatitis, diarrhea, dementia, death also occur. So niacin very, very important. It is important for dermatitis, skin problem, diarrhea for small intestine, large intestine, dementia for nervous system. If not treated, death will be happen. Sometimes it will administration in IV form also. Most of the neurologists would advise, okay, niacin. So in the diarrhea also you can advise the patient niacin multivitamin because here mentioned. Next we have vitamin B6. So B1, B2, B niacin and B6. B6 having this formula pyridoxine, pyridoxal, pyridoxamine. Okay. King function is again as a coenzyme. Okay, metabolism of amino acids. It is very associated with metabolism of amino acids, such as serotonin, histamine, niacin, coenzymes. Everything is that. Okay, God will not go into the detail. Next, we have functions. Already I told you that. Dietary 2.2 milligram per day. Again in the lactation and in the you have to increase. Egg yolk, fish, milk, meat have very rich B6. Wheat, corn, cabbage, root, tubers are good vegetable source. Okay. Dietary, if you have deficiency, neurological symptoms will occur depression, irritability, nervousness, mental confusion, convulsion, peripheral neuropathy are the symptoms. If excess, sometimes it will have some toxic effects in the body. Okay, like premenstrual syndrome. Okay, and sensory neuropathy. Okay, sometimes it will damage neuro also. Okay, next is biotin. Okay. Biotin. Okay, biotin is also known as vitamin B7 or vitamin H. Okay, second name of biotin. Okay, biotin chemical function is carboxylation reaction. Pyruvate carbolase. Okay, main is fatty acid synthesis, propionyl CoA, very important, metabolism of leucine. Okay, these are the functions of vitamin B7 or biotin. Other than that, uh, mainly it is utilized as a preventive or immunity resistant or immunity booster remedy, biotin. Okay, daily we need 100 to 300 mg per daily. In the animal source, we have plant source also, liver, kidney, egg yolk, milk, tomatoes, and grains, etc. If deficiency of uh, biotin will occur, anemia, loss of appetite, nausea, dermatitis, glossitis, biotin deficiency also called depression, hallucination, muscle pain, and dermatitis. But it is uncommon. Okay, deficiency. Okay, nowadays biotin also is giving in hair fall also. Okay, most of the companies giving biotin because to prevent hair damage. Okay, so here as a oxidization agent, it can use in the hair fall purpose. Okay, next is pantho pantothenic acid. Pantothenic acid is also a coenzyme. So all these are needed for the body. Okay, to maintain the immunity. Okay, to maintain the body normal function. Okay, all this chemistry is very important. So vitamins are very, very important for the body. How much required? 5 to 10 mg. Dietary source is plants and animals. Egg, liver, meat, yeast, milk, and etc. Dietary symptoms, what will happen? Patient, so likewise, burning feet syndrome. The patient have pain and numbness, so they will advise, they will complete. Okay. Anemia also, sometimes in the anemia also the patient have deficiency of pathogenic acid. Okay, pathogenic acid.